afternoon, and good evening. My name is Esther Kobel. I am a pediatrician and a child health advocate, and I would like to talk to you about access to medicines for children living with epilepsy in Uganda. Epilepsy is the most common neurologic disorder in childhood, and yet despite the fact that it is treatable, majority of the children in Uganda still struggle to get the medicines they need to live a happy and a fulfilling life. 1 to 2% of our population suffers from epilepsy. Majority of these are children. The good news is that 70% of people with epilepsy can live seizure-free with the appropriate medication. Now, in Uganda, the essential anti-seizure medicines like carbamazepine, phenytoin, sodium valproate, and levetiracetam, which are available in our public health facilities, frequently run out of stock. And because they frequently run out of stock, families are forced to pay out of pocket and buy them from the private pharmacies, which many cannot afford. I know a family that spends $48 on their child's anti-seizure medication every month, and this family barely makes $80 in a month. So because parents cannot afford to buy the medicine, their children end up having inconsistent and inadequate doses of their anti-seizure meds, predisposing them to frequent and uncontrolled seizures, which in the long run impacts on their cognitive development, leads to developmental delay in some of the children. Their school performance, school attendance tends to decline over time. But, well, there are solutions, and some of them are already happening. As Clan Child Health Africa, we have worked alongside families, health workers, the community to improve access to medicines for these children living with epilepsy. We have supported family support groups that have led to peer-to-peer learning amongst the parents, but also improved drug adherence in their children. We have supported the parents to build income-generating ventures, which enables them to buy medicine for their children, transport their children to the hospitals, but also be able to afford the broader cost of care for their children. We continue to advocate for a consistent availability of this medication in our public hospitals, and we educate the community about epilepsy. And through our experiences, we have learned that improving access to medicines for children with epilepsy cannot be done in isolation. It involves strengthening health systems, empowering parents, but also addressing the social realities that actually shape care for these children. By supporting parents, providing the medication that the children need, and reducing stigma surrounding epilepsy, epilepsy actually becomes a manageable condition rather than a life-limiting one. Thank you.